Hello to all of our listeners out there. Welcome to the Hordes Dairyman monthly webinar. My name is Kylie Anderson and I'm the editor for Hordes Dairyman magazine. I will serve as your host for today's webinar, which will focus on the cumulative effects of disease on beef on dairy cattle. If you're listening to the presentation live, you have access to a PDF of the slides that can be printed. The handout can be found in the handout section of the GoToWebinar control panel. In addition, if you have any questions for our speaker, you can type them into the questions section of the control panel, and we will address them following the presentation. Today, we welcome Dr. Melissa Cantor, who is an assistant professor of precision dairy science in the Department of Animal Science at Penn State University. Her research and extension program is dedicated to advancing the health, welfare, and performance of calves by combining innovative technology, nutrition, and applied solutions for farms. Dr. Cantor's work centers on early disease detection using automated milk feeders, activity trackers, and machine learning algorithms, with a focus on conditions like diarrhea and BRD. She also conducts applied research on calf nutrition, exploring strategies to enhance growth and immune development through colostrum management, feeding programs, and the inclusion of forages. She also chairs the annual Penn State Dairy Nutrition Workshop. Melissa, welcome to the webinar, and I look forward to hearing your presentation titled Beefin' Up Dairy, looking at cumulative effects of early life respiratory disease on dairy beef crossbred cattle.
Hello, everyone. It's so great to, well, I don't see you, but it's so great for you to be listening to me today. This is a topic that's, of course, becoming very exciting all across the world. And I think beef on dairy is really becoming something that is going to become more center focus as we move forward. And so there's a lot of research coming out in this area, and we're no different. We have jumped on this train. And so what I'm going to talk to you today about is really trying to understand what are the cumulative effects when a calf has a really early life respiratory disease event in terms of performance throughout that animal's life, and even how the carcass performs and things like that. And of course, we'll even very briefly touch on the very hot topic of the liver. So the first and foremost thing that I want to talk about is why beef on dairy calf health. Why are we even interested in this? What is the reason, besides the fact that they're worth a ton of money? So in general, we know this is true for dairy calves as well. Beef on dairy calves also, just like dairy Holstein calves, lack immunocompetence. And we know that in early life, these animals are highly dependent on maternal antibodies. This is super well established. According to recent USDA survey data, 90% of our calves are actually passing already when it comes to passive transfer of immunity status. But we're learning that that's not even enough, that we can push these calves even harder to get more immunoglobulins at the start, that a calf that achieves excellent serum total protein status, meaning 6.1 grams per deciliter, those calves actually do better than the ones that are on the cusp of passing at 5.1. However, that protective effect really only helps that calf out that first week of life, and then it starts to really taper off. It does help the calf out a little bit, but that's why we see diarrhea really commonly here. And then, of course, everyone knows about respiratory disease. Actually, the weather I'm experiencing in Pennsylvania right now is a breeding ground for respiratory disease. It's with the wind chill, 0 outside right now. Fahrenheit. For those of you that are international, that's going to be about -16 Celsius. So again, soon as it warms up on Thursday, it's supposed to be above 10 C, it's supposed to get all the way up to 45, 50 Fahrenheit. We know these calves are going to catch respiratory disease because of the stress they're experiencing. And these beef on dairy calves are not any different. A half of these calves are sick before they're even transported on the truck. That's going to be work from Dr. Kramer in Colorado, looking at a subset of beef on dairy calves throughout their travel journey. And 14 days after these calves arrive to their facility that they're going to be reared out on milk, 77% of them were showing outward signs of respiratory disease. That's super high, right? And that's from a study in Canada. So again, this isn't even just one regional area finding these trends. This is something that we're seeing across North America, and certainly probably elsewhere as well. We also ask the calf to do a lot of stuff, right? So these beef on dairy calves get put through even more stress than our Holstein or our Jersey purebred calf, right? We oftentimes are going to transport them right at the few days of age. They might get transported again at sale around weaning. They have to come off milk. They have to go on a high grain diet, oftentimes low in forage. And we also ask them to become a ruminant, right? So Again, I know a lot of this is very similar to what we do to dairy calves, but the beef on dairy calves have the additional pressure of having to move multiple times across facilities. And also, this is no surprise, right? This slide is familiar to anyone who works with calves. Respiratory disease is complicated. I wish it's easy to train people to find it. It's not. And we know that healthy calves have a lot of commensal microflora up in the upper pharynx. And for some unknown reason, and again, this is still a theory and not necessarily super well established, we theorize that stressors and external factors are why some of these natural microflora will actually go down into the upper lung here and actually cause infection or consolidation. And so respiratory disease is an interesting one because many different things can play a role in causing this healthy microbiome to move down and become an infectious pathogen. And then we also have viruses that can cause this that are independent of this pathway. We can have multiple co-infections. So again, it's a pain in the butt disease. We all know that. I don't think that's up for debate. And lots of things can cause this, as I said before. We have anything from Pasteurella multicida, which naturally lives in the upper pharynx of the calf. We have Mycoplasmopsis bovis. Then we have some other ones like Mannheimia hemolytica, and some that don't necessarily live up in the upper tract of the calf, but they're going to migrate down and they're going to become opportunistic in the environment, such as this Trichellosis pathogen. And that's not a comprehensive list. There's also viruses, but for the sake of time, I'm going to leave that out so that I don't spend the whole webinar on the intro to BRD. We also know lung consolidation in dairy calves affects future performance, right? So up to 2 months of age, the literature shows that these calves are going to grow about 0.12 kilograms to 0.13 kilograms less per day. That's going to be about 120 grams less per day. If we're thinking about in pounds, it's going to be about 3/4 of a pound less per day. And again, my conversion's going in my head, so it might be a little off. But just understand it's a pretty substantial amount of growth performance that we see that these calves lose when they have lung consolidation. We also know that in replacement animals, when we identify that lung consolidation during the pre-weaning period, we actually see decreased milk production as well, up to about, on average, 500 kilos. That's a substantial amount of milk when we think about decreased performance over a first lactation from a very early life insult. And so if we're thinking about that, it can be big to say that, wow, one thing in early life can really affect that animal. And so that's really where this hypothesis came from, is we know this affects the beef on dairy. We know this affects Holsteins and Jersey calves. What happens to these beef on dairy calves? And again, when we follow them down the line, what does this look like? What exactly is happening here? And so the objective for our study was to investigate what is the association of lung consolidation at weaning on the growth performance of these calves up to 238 days. Now you might be asking, why 238 days? That's kind of random. Well, that's often commonly when we'll be transitioning animals out to a feedlot. So for us, we were curious, prior to going to the feedlot, which is a very high-risk respiratory phase, what is this early life effect on growth? And that's exactly why we separated it out that way. So the study design kind of worked like this. We were also really interested in the impact of breeds. So we did follow different beef on dairy crosses, and these were controlled crosses. What I mean by that is we actually had select sires generously donate this semen to us, and in exchange for some information about growth performance of these animals, we were able to know the exact sires that were going into these dams at these dairies. So we had Holstein crossed with either Simmental, Angus, Red Angus, or Charolais. And what was interesting about this for me is I didn't even know how cute the beef on dairy calves could be, that they actually kind of look like Skittles with all the different colors that we saw compared to just the Angus that you typically see as a cross with the Holstein. And they started out, of course, at that dairy farm. They had to have passive transfer immunity in order to get paid by us. So this was a criteria. So I want to acknowledge that all these calves started off with a good set of colostrum. And that's important because that's not necessarily representative of every surplus calf, right? But we didn't want to confound the calves by having poor health from the start. So we really wanted to set them up for success. And then we transported them to a calf ranch where they were raised by someone from an upper order Amish community. And this is very typical calf raising for Pennsylvania or even the Northeast. It's quite representative. And the calves were fed by bottle, offered free choice grain and water by bucket. And then, of course, we fed them up to 6 liters a day. And then we weaned them across a week. And then they were raised in this hoop barn for this study. So again, this was from basically right after weaning, so 4 or 5 days after weaning, all the way out. We call this the grower ranch phase. So essentially this phase is they're getting a total mixed ration. They're all commingled together and we just want them to grow. We're just like, hey guys, will you please put on weight? That's all we need from you right now. And we did a lot of this slide actually got a little bit convoluted here, it got cut off. But basically what we wanted to know is weights. So we weighed these calves at birth, 4 days after weaning, right after 2 weeks after arrival to the new facility in the hoop barn, and then again right at that 238 days of age. Here's where we wean the calves. We tried to wean them at 2 months. Again, this is plus or minus 14 days of age because the youngest calf in the group was our cutoff for that weaning. So some calves were going to get weaned a little bit earlier than 60 days. And this is very representative of the beef on dairy industry in Pennsylvania. So we're trying really hard to kind of mimic what commercial conditions look like. And what we did is we followed up with a lung ultrasound right around this weaning age. Again, we know weaning is a high risk period for respiratory disease, and we use that 1 centimeter cutoff as our definition for that lung consolidation. And then we followed up again at day 83 to see, did they cure, did they not, were they still sick, did they get worse? Now, we calculated average daily gain in a nutritionist mindset kind of way, because again, my collaborator, Dr. Tara Felix, wonderful beef nutritionist, excellent person, works in the feedlot industry. She and I both are very much logically thinking in the way of how farmers would care about growth, right? So we have period 1, which would be the pre-weaning phase. So it's going to be birth to 4 days after weaning. Then we have period 2. This is going to be the high risk phase. So this is when calves are post-weaned, they just got transported, they're at a new facility, they're being commingled, they're in a really high risk phase for poor performance in general. We call this the post-weaning slump sometimes in the dairy industry. And then we had period 3. This is a major point of sale point. And so Ingrid, for full acknowledgement that this is the master's work of Ingrid Fernandez. She's a PhD student in my lab. She also works with Dr. Felix. We co-advise her. This is a huge point of sale. So a lot of times these farmers will sell these calves at these points, but this is a big one, right? So this would be a lot of times when calves are being sold to a feedlot for finishing. And we wanted to know if growth was compromised in those animals. So I told you that lung consolidation is going to be that 1 centimeter cutoff. And essentially we use some of the definitions that Terry Olivet at Wisconsin uses. I think her work is pretty well established across the world at this point. Again, we're looking for a hypoechoic line. A bright white band is absent in the pleural interface, meaning that we're no longer seeing that refraction artifact that we normally would see in a calf that's healthy. And when the calves were lacking those things, we would actually measure the area of consolidation in the screen grid. Again, we were really interested in that 1 centimeter, and you might be wondering why. That's the smallest amount of lung consolidation established in the literature to be associated with compromised growth. And there's some work done by Bart Pardon out across the ocean in Europe, and he has found that to be a pretty important clinical intervention point. So we wanted to stick with what the vets say are the best definitions. We also recorded in between. So, this is a calf that's transitioning towards pneumonia, but is not quite clinical yet. And 3 centimeter is going to be a universally accepted definition for pneumonia. So that would be a calf that's not only consolidated on the inside, but also clinically looks abnormal to the farmer. This calf is almost always going to have coughing and some sort of external signs like elevated rectal temperature, nasal discharge, etc. And so again, we wanted to make sure we documented that. Of course, this is the nitty-gritty, not so exciting piece, but we did use some linear regression models for this, where we were really interested in whether or not that association of that early life lung consolidation is associated with the interaction of growth period, the breed, and we had calf as a random effect. And again, one other thing, I have this here to remind me. I see there's always logic to my madness. I was like, Why do I randomly have statistical analysis in here? The reason for that is because we were also interested in how severe lung consolidation is and whether or not that affects growth. So one was, does consolidation of any kind affect growth, yes or no? This model said, does the degree of lung consolidation affect average daily gain differently compared to healthy calves? So we had healthy calves, we had calves that were in the intermediary stage, so that would be 1 to 2 centimeters. Then we have the 3 centimeter calves that are typically labeled as pneumonia in the literature. Those are usually animals that also have clinical outward signs of disease as well. Now, one thing I should mention is for us, we didn't say they had to have outward signs at 1 centimeter. They just had to have lung consolidation for our definition. So keep that in mind, because farmers ask me that all the time. Well, are these calves that I'm going to see with my naked eye? Not necessarily. Sometimes yes, but not always. These guys are perfectly healthy calves in the slide, but they could have 1 centimeter if you didn't know, right? So that's kind of the point. What exactly did we find? And I'm kind of rushing through this, my bad. So what we found, and I do think this is pretty interesting, we found that calves have compromised growth in the post-weaning period, but there was an interaction. So you can see here very, very clearly that in period 2, those control calves actually grew better. So control here means healthy calf. Those healthy animals that did not have any BRD, they did not have any lung consolidation, they didn't have any history of antibiotic treatment, those calves grew better in that 61 to 83 days. I like to call this the high risk post-weaning period. A lot of times this is when producers complain about the post-weaning growth slump and things like that, than those BRD calves. And I think that's kind of interesting to think about because it's kind of what you would expect, right? So again, right at the end of period 1, we're saying these calves are sick or healthy, so we expected this interaction. But equally, what I find fascinating is that by period 3, so this is going to be that day 83 to that 238-day period, these calves grew very similarly. And I do find that very fascinating because we do not know why. Like, why was there this compensatory growth here in these calves when you wouldn't expect that per se, right? But we did see this insult happening in period 2. Now, the nutritionist in me might wipe my hands, be done with this work and walk away, publish this paper and say BRD does not have long-term effects, right? Because technically, all the way up to 238 days, we didn't see those growth effects. However, get ready for later. I will give you that information on what happens to the carcass later on, because there are some interesting findings there. Now, remember what I said earlier about how we separated by how much lung consolidation these animals had. So again, apologies for it being in kilos, but what we found is that essentially these calves that are growing without lung consolidation, they're growing about 2.5 pounds per day or 1.18 kilos per day when they're healthy, compared to the calves with 3 centimeters. The 3 centimeter calves are growing about 2.2 pounds per day. So there's a substantial difference there. And remember, what I said before is these 3 centimeter calves are typically the level of consolidation that we associate with pneumonia. So again, these are going to be calves that the farmers are detecting as sick and treating pretty much most of the time. This is also the threshold that affects future milk production. If a calf gets to this much consolidation, no matter when it happens in that pre-weaning period, it's associated with reduced milk production in the first lactation. So it's interesting that we're seeing these compromised growth performances as well. Now, one thing I have to say is we just had this intermediary of 1 to 3, right? And you can see here in period 2, so again, that's that day 61 to day 83, these calves are just similarly growing to the healthy calves. They're not different. They're also not different from the 3 centimeter calves. What's interesting is that the 3 centimeter, though, grow much less per day than the healthy in that period 2. So what that tells me is our cutoff when we're trying to say, you know, 1 centimeter does have an effect, and we'll talk about what that is later. But when we're strictly looking at growth, it does appear that 3 centimeter calves are going to have lost performance in this short phase. Why they don't have lost performance in period 3 and onwards is unknown. But this is still really interesting to me. And I also want to let everyone know, we had 145 animals, 37 of them with respiratory disease. So again, in the 3 centimeter category, we probably had, I want to say 10 calves. It wasn't that many animals. So keep in mind, this is very exploratory, cutting it out by lung consolidation, but we were very well powered to be able to say growth differences occurred. And that is very clear, right? Healthy calves grow better. This is not really a surprise to any dairy farmer. They're all going to nod their heads and say, yeah, of course, that makes sense. We were also really interested, though, in what pathogen shedding would have an effect on this growth, right? Is this growth pathogen problem pathogen specific to the calf, or is it just a generic effect, right? No matter what, if you get lung consolidation, you don't grow as well after weaning. If you're these beef on dairy calves, it's particularly in an environment where they're transported right around weaning a couple days later. The other thing I want to highlight too is, remember, these calves got really nice colostrum. So we're talking 10% of body weight, and they all had to have passive transfer immunity at 24 hours of age to even come on the truck. So again, we were pretty strict, and we still saw respiratory disease, just suggesting what a challenge this disease is for us in managing all dairy cattle in general, and beef on dairy cattle too. And just a full disclaimer, I did not disbud this animal. I know she's got some horns. I just thought it was a cute picture. This was not one of our animals. We were really interested in investigating that association of lung consolidation at weaning on the odds of pathogen shedding, and of course the performance up to 238 days, which is essentially what I just said. So that's what we wanted to know. What do you guys think? What did we find? Well, first I have to give you some criteria that we use. So again, we being Ingrid, a student doing a lot of the work on this. So again, we had 37 calves that naturally had this lung consolidation around weaning. And the BRD calves had to meet very strict criteria to be part of this study. There were a couple calves that got treated with antibiotics prior to this and had to be eliminated. They received penicillin, they couldn't be in the study. But almost all of them had not, because they were on this very conservative Amish farm that didn't really believe in florfenicol or tolithromycin or some of the more aggressive antibiotics we use. So again, we had really strict control on how much medication these animals received. And because of that, we were able to be very strict. So what we did is we had these BRD calves, there were 37 of them. They had lung consolidation of at least 1 centimeter a couple days after weaning. They were not allowed to have diarrhea at any of the points that we recorded calf health, being when the calf arrived. Every time we brought in calves for the first 14 days after arrival, we were checking the health of those calves. We also checked the health of the calves when we castrated the males at day 28. And the farmer also checked the health of those calves. That's just to remind me not to stay on the slide too long. I'm going to go back. We also really wanted to make sure they passed. So again, that was another criteria. We then matched those sick calves to healthy calves using the sex of the animal. So we always had males with males, females with females. We had the cohort. Again, that would be when the calves were born, plus or minus 14 days. We really wanted to control for age. And then, of course, we had birth weight as well. So heavier calves were matched to heavier calves, lighter calves to lighter calves. We also visually matched to coat color, but I was unable to tell which ones are Simmental and Angus. So for those of you buying beef on dairy calves, just know sometimes you're buying Simmentals and you might think they're Angus. That's not going to matter for getting them certified as Angus, of course. But it was annoying for the science because I didn't think about that. In hindsight, we should have labeled those animals. But I don't think breed has too much of an effect on pathogen shedding anyway. They were all in the same environment, remember? So then we had control calves. As I said before, those are going to be healthy animals, never had diarrhea, never had antibiotics. Again, this was an extremely healthy group of calves because they got to benefit from herd immunity because they all got really good colostrum at the start of life. And again, they had to pass. So what did we find? What were we seeing here? So what we did is we did these nasopharyngeal swabs at weaning on these animals. And so this is right when we're doing the exam. So we would basically find a sick calf, and if it was a sick calf, we would swab that calf. And we only swabbed the healthy pair match calves. So we did all the pair matching on site that day. And we sent these off to the University of Wisconsin Diagnostic Laboratory in partnership with Dr. Sockett. We wanted to look for multicida, trehalose. We wanted to look for hemolytica, somni, salmonella, and we also wanted to look for bovis as well. And we did bovis by PCR because it's an anaerobic bacteria. It's not going to grow on a plate, but we cultured out everything else. And I'm super curious about this results because I think there's so much we still don't quite understand about respiratory disease, and I'm hoping I'll show you that in our slides here. We, of course, ran logistic regression models, so now we're more interested in the odds ratio outcomes. So again, we're curious about risk, or particularly odds. So we want to know, what is the probability of essentially having lung consolidation at weaning with shedding particular pathogens? And we also wanted to know, is it possible that lung consolidation is actually going to be dependent on what pathogen you have and how it affects growth, right? So we had two questions we were wondering. One, does the pathogen affect growth? And two, does the level of severity that you actually experience have something to do with the pathogen that you are particularly shedding? Meaning, when we do a deep nasopharyngeal swab all the way to the middle canthus of the eye here, this is where the sample would be taken on that calf. When we do that, what pathogens are culturing out on the plate at the diagnostic lab? That was what we were curious about here. So hopefully that makes sense. And so what did we find? And here's our lovely little children here in this slide. This was my favorite one. She really liked me. She was always at the front. But you can see what I mean about Skittles. Not to get too distracted. They were very cute. So Pasteurella multicida was the most isolated pathogen that we observed. In fact, remember I told you we had 37 of those animals that had respiratory disease. 35 out of 37 came back with Pasteurella multicida. And then we had one case that came back with trehalose, and then one case that came back without anything. Again, this is so fascinating to me because essentially what we found is that there was this one dominant pathogen in the environment that was associated with the lung consolidation we were seeing in our calves. And you can see here that the case calves, that there were 20 of them, so over double of them were shedding this in the nasopharyngeal swab compared to healthy controls. Remember again too that this is a naturally occurring little guy that lives up in the nasopharynx of these calves. And you can see too that the trehalose animals, there was just 1 in 1. So again, pretty rare occurrence happening. This was something Dr. Sockett had suggested we look for. In general, 57% of the BRDE cases and 26% of the controls. Super interesting stuff. So what I think is really fascinating is that essentially these control calves had a much lower likelihood of shedding Pasteurella multicida. So while some healthy calves were in fact shedding this, most of them were not. In fact, they were 79% less likely to be shedding Pasteurella multicida if you were a healthy calf compared to a calf that had 1 to 2 centimeters of lung consolidation. Similarly, now this is really cool stuff. If you're a calf that has that 3 centimeters that we typically associate with pneumonia in dairy calves, so this is going to be the calves with reduced milk production if they're a dairy animal, reduced growth, those animals that are healthy are 90% less likely to shed Pasteurella multicida. So what does that tell us? That tells us that shedding with these and again, this is kind of the gold standard that veterinarians do. If you're trying to figure out what pathogens are causing respiratory disease on your farm, nasopharyngeal swabs are a good compromise. You identify calves with new infections before they're treated. You give them a nasopharyngeal swab, you send it off to the lab, you see what's affecting your herd, right? And if you're working with your vet, you're also doing antimicrobial resistance testing too to see what antibiotics actually work on the pathogens you have. You're going to have some healthy calves that are going to naturally shed this, which is why it's so important to use a lung ultrasound or some other criteria to decide who you're going to swab for that. So I just think this is really neat because it's exactly what we see in the literature with the pathogen shedding. However, while we saw a lot of multicida associated with respiratory disease, it did not affect growth per se. So again, these Pasteurella multicida calves that are sick, they're going to have about 0.96 kilograms per day. And then the ones that are sick but there's no pathogen identified out of that culture, they're going to be 0.94 kilos a day. So again, compromised growth, yes, but the pathogen shedding itself was not associated with that. However, if you're a sick calf, particularly 3 centimeter sick calf, you are much more likely to be shedding Mulchicida in general. So pretty cool stuff. This actually agrees with some of the work that's been done in Quebec. They've looked at this in dairy animals with a cross-sectional study, and they found very similar results. So Sebastian Buzinski found this, that essentially Mulchicida is not associated with poor growth, that's shedding at least, but of course pneumonia reduces growth in general. And they also found that something like Mycoplasma bovis, which has a new name, I think it's called like Mycoplasmopsis bovis, that one reduces growth, but we didn't see that on our study. So sorry, I get really excited about disease. I hope you guys can tell. I just think this stuff is really fascinating, to be honest. Now, when we think about intramuscular adipogenesis, nobody knows exactly the time frame when this is definitely happening. However, the most well-established identification is that we see a lot of adipogenesis initiating right before birth and also up to 250 days. In slaughter, that window's pretty closed, right? So again, the density of these multipotent cells is going to be the highest the younger the animal is. And really, when we think about that day 61 to 83 in the animal's life, the beef on dairy calf's life, this is a time frame when probably we can manipulate this intramuscular adipogenesis. So the less scientific name for this would be marbling, right? So marbling is very desirable, especially in the American beef industry. That's how we pay. This is essentially how everybody's paid. This is essentially how a lot of feedlots make their decisions on if they're making money or not. But reality is that the early life post-weaning phase is probably an opportunity here, right? And again, we're having hyperplasia here and then hypertrophy. So again, we have the cells set by the time we're in the feedlot, but we can make them a little bigger. Whereas here, we're really working on that potency. So you might be wondering, okay, you've hinted at what happens long-term throughout this entire presentation. What exactly went on? What's going on? So again, this would be the feedlot, and this is actually now very recently just came out in the Journal of Animal Science, so it's no longer in review. It just got published under Felix's name as the corresponding author. We found that lung consolidation in early life was actually not associated with the feedlot performance like you would expect. Again, average daily gain was disappeared by 238 days. So we were not shocked that the growing phase was not associated with it either. This was not really a surprise for us. Again, they were just growing about a little over 2 1/3 pounds per day, 1.1 kilos per day. Again, that initial arrival weight was not different either. So again, they weighed the same right at the arrival of that feedlot. Again, remember, at 238 days, they weren't different. We weren't expecting anything here. We also weren't expecting anything at final body weight at the feedlot as well. So this would be right before the animals go to slaughter. So again, they were about 640 kilos prior to slaughter, roughly 1,400 pounds. I'm doing very crude conversions here, so forgive me if they're not perfect. Again, average daily gain was not different, dry matter intake, so we did have access to grow safe feeders in this study. So we were recording daily feed intake. We did have an acclimation period of 2 weeks where it was a washout, so we let the animals get used to using the system. They had to know how to navigate it. And then we had our little master student, our Ingrid, doing an amazing job recording this so that we could get dry matter intake. And you can see that was very similar between the groups, almost identical actually. Gain to feed ratio. So again, this is pretty much how feedlots are going to decide how efficient they are, how well they're doing. You can see that this is also very, very similar between the two groups. Again, we're not surprised, right? If average daily gain is the same, dry matter intake is the same, the gain to feed ratio is obviously going to be the same as well. And so the efficiency to gain ratio for the feedlot people would be average daily gain over dry matter intake. That's how we calculate that. And that's the feedlot nutritionist way of assimilating how well things happen and how well they performed. The days of age were the same, which we hope so because we controlled for that in our study. So that's not a surprise. So you're probably wondering, okay, so you didn't see any growth differences. If I was a nutritionist, it would be very easy for me to publish this paper and then just move on, right? This is where I think the collaborations need to keep happening because there's more to it than just this piece. We're going to talk about that in a second here. So there was an association of lung consolidation and weaning with carcass characteristics. So again, some more of that meat science vibe. So it's really important that we're not just looking at one lens when we're thinking about something like early life disease, right? So we have this early life insult of respiratory disease. Affected growth for 61 to 83 days, no longer affected growth all the way out to the feedlot, similar gain to feed, similar dry matter intake. It'd be very, very easy to put your book down, walk away and say, respiratory disease does not compromise animals long term. However, I think this is why collaborations are so important and why I'm so thankful that Tara Felix and I did this work together. We found that cattle with lung consolidation at weaning tended to have 3.05 increased odds of scoring select versus a better grade of choice or prime compared to healthy. I'm going to let everyone digest that for a second because how a carcass grades is the biggest underlying factor of determining how well the feedlot producer gets paid. So if an early life insult at weaning, when oftentimes the feedlot owner doesn't even own that animal, has a carryover effect that potentially affects their ability to grade prime or choice, it really suggests the need for this type of longitudinal research to further suss these things out. And you could argue, well, you know, you had a tendency, and that's true. But at the end of the day, the fact that something so early in life carried out that long, it puts pause for thought. And I agree. I think we need to repeat this study. Someone else needs to repeat this study. It was very expensive. So someone else can repeat this study to see if they continue to find this, because remember, these are calves that had really good colostrum. These are calves that got the minimum required feedings of by NASEM, the 6 liters a day, 0.84 kilograms per day of dry matter intake of milk replacer powder. Again, these are calves that were on a high quality calf starter, 20% crude protein, had a little bit of 2% crude fiber. My point is, these calves were not the calves that were fed 3.5 liters a day, that were only fed once a day, that, you know, all the things that we know potentially happen in this beef on dairy industry. These are calves that are already getting pretty decent care, and they're still having this insult of respiratory disease carrying on that long. Now, I'm just saying, it's food for thought for all of us that we might need to work and collaborate together a bit more to kind of realize some of these effects. We also saw that cattle with lung consolidation at weaning tended to have 1.98 increased odds. So again, 98% increased odds of having that lung scarring at slaughter than healthy cattle. That's really not a surprise. Surprisingly, if you have respiratory disease events in early life, it might affect your lungs and affect you at slaughter. Again, this was a tendency, probably because we didn't have a ton of pneumonia calves on our study. We only had about 10. So definitely, we can't conclude this for sure, but I can tell you that this just says that, yes, your lung ultrasound found pneumonia or found respiratory disease. And again, I know it's a tendency, but I think it's really important for us to be thinking about these things when we're doing this type of research, right? Like maybe the early life factors do matter if we're trying to look at carcass effects or things in the feedlot. Something to think about. Real food for thought. Now, this is the slide I've been holding back on you. I have purposely not given you the slide until now. You can see hot carcass weight was very similar. It was identical, and that makes sense, right? Average daily gain and all that stuff. Dry matter intake are similar. Dressing percentage even similar, which is very fascinating to me. That we were able to hit that gold standard of 62% dressing percentage. That's because Tara Felix is an amazing nutritionist. And you can see here ribeye area was similar, but marbling score was not. Again, this to me is the biggest takeaway that I want everyone to get from this study. We might think that we can walk away because the growth impact disappears in an early life respiratory disease event around 60 days of age. However, if we follow these animals all the way out, that respiratory disease effect has a dollar value attached to it. So it goes back to the tendency to grade in a different category. It goes back to the fact that marbling score is decreased, so that least squared mean marbling score is lower or decreased compared to the healthy calf that had an increased score. Again, these are real numbers that these guys are being paid off of. And so it's important for us to be thinking about these things. And you might be willing to just walk away and say, well, it's just one factor, but it is the factor that decides the difference in a margin of profitability or not. It plays a pretty big role in the feedlot. Now, when we look at the breakdown, because some of you might be curious about that, we had 35 healthy animals grading in that upper 2/3 choice or prime. So we're pretty proud of that. That's a really nice breakout. 60 of them were in the low choice and 9 were in select. We flip that over to this side, and you can see that respiratory disease really seems to have some sort of role potentially in this breakout here. And again, now I know that the odds ratio was 0.06 in terms of tendency, but if you look at these differences in numbers, I think we need to do this again, or someone else needs to do this again. We fed these animals a pretty high forage diet compared to some of the more hotter rations that we see that are mostly dry shell corn and Texas A&M and things like that. Now, hopefully you won't ask, hopefully there isn't any feedlot nutritionists on the line. I am a calf nutritionist, so that's not necessarily my biggest forte, but that paper is in Journal of Animal Science if anyone's curious to look at that. But I thought this was cool. Now, there's probably someone in the room wondering about the liver, right? Because that is another thing that we think about. So what about liver health? So we actually took all the condemned livers that were produced on the line, and we sampled all of them using sterile techniques. And we found that actually 91% of our livers were considered edible, and it was not different between the control and the BRD animals. You can see the condemned score was also very similar. Here's the breakdown of how they graded. We had very, very, very few liver abscesses. So actually we took any condemnation whatsoever for the liver and broke it out in such a way and gave it a score. No differences at all. In fact, we had so few animals with liver problems, and I think it was 12. Yeah, 9 + 3. So 12 animals out of 140 some animals that actually had liver issues. So it was a very small percentage, but I'm going to show you a cool graph on the next slide, I promise. You can see this would be animals that had actual scarring. And then here's how the breakdown of the scores goes. And I would take this particular graph with a grain of salt, again, because this was binomial, so we compared one to the other, not all across. But it's just interesting to know that the livers of these animals were actually pretty healthy. We had designed this entire study thinking there would be a link between BRD and livers, and we didn't find it. So what about liver health? So this is a principal component analysis, and what it's doing is it's actually trying to explain the variability among the different samples. And so what we did is we actually had a collaborator, Dr. Ganda, who's a microbiologist, and she essentially found what the microbiome was on these livers. And we had animals that were labeled as control animals or BRD animals. We tossed out any animals that had lung scarring at slaughter. So again, the pneumonia cattle were not included in here. We tossed out them. We tossed out anybody that had antibiotics or any other health problem in their life. And we just stuck with this. And so what we found is nothing. So the liver health of these animals appears to be pretty similar. In fact, you can see that so normally if they're different, you'll see that the circles will separate from each other, and they'll actually look like they're clustering away from each other. And you can see they're pretty randomly distributed around. They're not different. We were really expecting that the microbiome of the calf that gets a respiratory disease event might affect that animal for life and potentially compromise them later. We didn't see that at all. So our little link or our suspicion was disproven. I probably wouldn't pursue this anymore. Part of this, again, we only had 12 animals. So again, we excluded any condemned livers from this. This was just respiratory disease calves that had normal livers. So when we compare normal liver respiratory disease in early life to normal healthy animal liver at slaughter, there's no differences. We did toss out anybody that had anything wrong with them, and nothing was to be found. So just in summary, lung consolidation does appear to affect calves about 0.14 kilograms per day for just about 3 months, and then they eventually catch up. This actually agrees with absolutely every study out there. They all find this variability here. Again, that's going to be about, I would say, probably 1/3 a pound per day. Again, really rough conversion that I'm doing in my head. But the good news is they do compensate. They grow very similarly later. The downside to this, though, is that there are some carcass characteristics affected. So something about respiratory disease at that first 8 weeks of life is associated with a decreased marbling score. It also increased the odds of being in the select category or just not growing very well. And that's important because that is how these farmers are paid. So with that, I really want to thank everyone for their time. And I know that Hordes has a couple slides for you as well, so I'll entertain your questions after that.
Fantastic. Well, we hope you make plans to attend our next webinar, which will take place on Monday, February 9th. Note we'll move to 6 webinars in 2026, and this will be hosted by Scott Polk of the University of Missouri. And we did have some questions come in, Melissa.
Yay, I love questions.
Yes, I'll start with the first one. Maybe it was a misinterpretation of the kilograms, but this is a low average daily gain. Would there be a bigger growth difference if you had faster gain?
So I want to make it clear. So that 0.12, I'm going to actually do the conversion right now. Yeah, oh, I was spot on. It's like 0.26 pounds per day. So that 0.12 was the reduction in growth. So the average daily gain of those calves, actually, I'm going to go ahead if it's okay.
Yeah, flip back to that slide.
Let me flip right back to the first figure here that we had, because it's pretty far back there. So if we look here at this guy, these calves were growing about 0.5 kilogram a day in the pre-weaning period, and then over 1 kilogram per day after that. So that's about 1 pound per day here, and then 2 pounds per day there. And then their question was, had you had different growth, do you think you'd expect that? I would say that this 0.5 kilogram per day of growth is pretty typical of calves that are offered about 6 liters a day of milk replacer, and 1 kilo per day growth after that is pretty typical, pretty representative. Now, of course, had we fed them a more accelerated milk plan, could we have potentially seen less effect? That is $1 million question, and I actually don't know the answer to that. That's really worth pursuing, but I will say it's very close to what we see in the literature in terms of these feeding levels for calves. Hopefully I answered that question.
Great. Otherwise, if you want a clarification, feel free to type it in the chat. Another question. Were most respiratory tract infections acute or peracute?
Most respiratory tract infections acute or peracute? I'm not sure if I understand the question. I'm not sure I understand the question. I'd be welcome for some clarification, but perhaps they're asking whether or not these animals looked clinical. Most of them did not. They seemed like completely normal animals that just had 1 centimeter of consolidation on the screen based on our criteria. They certainly would have fooled them, and plenty of them beat me up while we were ultrasounding them. Feel free to send a clarifying question on that, because I don't think I necessarily understand the difference.
Okay, we have another one here. Did calves move between the different groups for each period depending on the lung ultrasound? Or how were they grouped if the first ultrasound was different than the second?
Great question. Yeah, that's an excellent question. Yeah, so we actually kept everybody. So that's a really good question. And actually, it was quite the headache for us to make that decision. So we kept calves in the category, if they had that lung consolidation at weaning, then they stayed in that category, even if they ended up resolving or if they advanced. It didn't matter. Like that was their entry to that category and it stayed stable throughout. That's a very good question because we played with that a lot too. Like we had that 83-day follow-up. 25% of the calves had cured at that point, so it was like, what definition should we change? And we ended up just keeping it stable, especially because we only had 37 at that entry period. And we knew that our power was already pretty much at the threshold of where it needed to be to follow them out. But that's a very good question. We did commingle them all in the same group together. Not necessarily great for the healthy calves, but they stayed with those animals, even if they're identified as having lung consolidation. So we categorized them and kept that category, but they were all housed under the same roof, essentially, from period 2 to period 3.
Great. Another question. Thank you for a nice presentation. If this happens on the dairy farm, can we expect the lower performance because of the lower pre-weaning average daily gain and liver health?
Can you read the question one more time, actually?
Yes. If this happens on the dairy farm, can we expect the lower performance because of the lower pre-weaning average daily gain and liver health?
What a great question. I would say yeah, it's so hard to know, right? Like this is the next, I personally think, I don't think we know yet. I think that's a really, really good point to highlight. Like, how do we know if the liver health is necessarily related to this? Based on what we saw, they don't seem to be linked, but feedlot respiratory disease is definitely linked to liver health. Like that's been well established. This early life respiratory disease is still up for debate because we didn't see that. But when you see this reduced growth related to respiratory disease, the dairy industry sees this too, regardless of the feeding strategy they're offering those calves. Pretty much the only study that hasn't, so even a study done in Ohio with Terry Olivet's group, they looked at, and Dr. Kramer, they looked at that 1 centimeter of lung consolidation in calves ad libitum fed milk. So these were robot calves that were allowed as much milk as they wanted, right? Some of these calves are drinking 12 to 15 liters a day, and they still saw that reduced growth of 0.12 kilos a day, which is, I just did the conversion on my phone. It's 0.26 pounds per day of reduced growth. And again, so I think, yes, our calves had pretty limited growth in period 1 because we limit fed them. But even this has been replicated in the dairy industry, and we see the same thing. So I'm going to go ahead and say I do think it's the respiratory disease that's contributing. It's a very immunologically expensive disease, costs a lot of calories to fight something like this. So I do think that is the case. The liver, on the other hand, I think we still don't know. Big question mark. I think we need a lot more research to look at that, but that's an excellent question.
Great. Another question. Have you looked at other disease effects such as scours or coccidia?
I'm so glad. Hopefully you're reviewing my grant. We actually have a grant in review right now with our government here in Pennsylvania to look at what the effects of diarrhea are from the long-term phase and even just from a histology phase. I don't think there's been enough work done on that, and certainly not calves that are fed a beef on dairy diet. So yeah, that is actually our next goal. We have a grant in review for that. We really want to know. I suspect that diarrhea has long-term effects too, and nobody's actually ever looked at that. The challenge is doing a study that can control disease enough that you can get enough healthy calves to follow out, because it's amazing how many calves get scours at some point in their life when you follow them every day. Yeah, very good question.
Great. Those were the questions that we had come through.
Nice.
So thank you for those answers, Melissa. We really appreciate it. And thank you for your presentation. Thank you for what you shared today. And to the listeners also, thank you. We appreciate the time that you spent with us, and we hope to see you in the audience of a future webinar or catch a Hordes Dairyman podcast. Until next time, goodbye from the team here at Hordes Dairyman. Thank you.
Thanks for coming.